Less may be better when it comes to treatment for breast cancer. Two new groundbreaking studies presented at the American Society of Clinical Oncology annual meeting found lessening doses of duration of some toxic treatments can be done without jeopardizing their survival.
The chemotherapy is a blunt instrument. It works by essentially killing any cells that are rapidly dividing. And cancer cells have that characteristic. They rapidly divide, but so do some normal cells.
Dr. Joseph Sperano, an oncologist at Montefiore Medical Center in New York, is the lead author of the TAILOR-X study, a phase 3 trial that looked into whether women with a specific type of breast cancer could be treated without chemotherapy.
So what we did in this trial was to integrate a new diagnostic test, a test that evaluates the expression of a panel of genes to see if we can identify or use it to assign therapy in situations where we knew chemotherapy was really beneficial, or in situations where we knew chemotherapy was not beneficial.
The test takes a patient's expression levels and transforms them into a score from 0 to 100. Women with a high score are at a higher risk for recurrence and would need chemotherapy, and those with scores from 0 to 10 can be treated with hormonal therapy alone and don't need chemo. But what about the women who scored in the middle?
And what we really zeroed in on was the 2/3 of women who had the score in the mid-range, which could be up to 60,000 women a year in the US. And what we proved was that these women don't need chemotherapy. They don't benefit from chemotherapy, even though we would typically recommend it.
58-year-old breast cancer patient Phyllis Lassetti was one of those women with a mid-range score.
Because I knew right away, like, you have cancer, you're going to do for chemo. So that's in the back of my mind. But I had 2 kids at that time, and if that's what I had to do, I had to do it.
After undergoing a lumpectomy and mastectomy, Lassetti signed up for the TAILOR-X trial and was randomized into the non-chemo group.
I think it's good that they have these trials for women like myself to have the opportunity and choices. Because it shows that 11 years later, I'm fine. I didn't do the chemo. And if I would have did the chemo, the outcome probably would have been the same, but I would have had like lingering side effects.
While chemotherapy has saved thousands of lives, the harsh side effects can include hair loss, nausea, infertility, neuropathy, heart damage, and an increased risk for leukemia.
The vast majority of women were getting chemotherapy after surgery to prevent a breast cancer recurrence. And now the pendulum is swinging back to less chemotherapy use, mainly because we know which are the patients who are the ones who are most likely to benefit from the chemotherapy.
Another study called the Persephone trial also looked at de-escalating treatment for patients. Dr. Helena Earle, a professor from the University of Cambridge in Britain, looked at whether women with HER2-positive early-stage breast cancer could be treated with the drug Herceptin for 6 months instead of 12. Herceptin has improved survival and recurrence rates for over a decade, but its side effects can include damage to the heart.
When Herceptin was first introduced, the 12-month period was almost plucked out of the air. There wasn't any evidence of how long you would need to carry on with a targeted treatment to get the effect.
Earle's study found the disease-free survival rate at 4 years was nearly identical for patients in both the 6 and 12-month groups. Plus, the side effects were much less common in the 6-month group.
Pain, cough, fatigue, chills and palpitations. These were the 5 where we saw fewer problems with the 6-month patients. So we were able to show the treatments were of equal efficacy and we've reduced toxicities.
Most doctors agree that new studies like Sperano's and Earle's address the need to look at whether the toxicity of cancer treatment can be reduced. But more work has to be done to truly confirm if this less is more approach will allow all patients to live well longer.